So hi and good afternoon. I'm Kalani Gray and I work within the Office of Planning, Research and Evaluation in the Administration for Children and Families in the Department of Health and Human Services. This session comprises two informative presentations, and we plan to leave time for question and answers at the end of the session rather than at the end of each presentation. However, you may enter your questions, any questions that you have, in the chat during the presentation so that we can address them at the end. When sharing your questions, please indicate to whom the question is directed. We will try to respond to as many questions as possible. And so I think we will be starting with Briana Bostic. Briana is a postdoctoral fellow at the Baltimore Education Research Consortium. Before earning her PhD from Johns Hopkins School of Education, she taught preschool in the Chicago public school system. Her research focuses on teachers' overall job demands and resources across geographic context and a child's social, emotional, and behavioral development in early childcare and education settings. She is interested in how teachers' sense of community impacts how they understand themselves, their work, and their students. And with that, Briana, I'd like to turn it over to you.
Hi, everyone. Happy to introduce myself. My name is Briana. As mentioned before, I was a preschool teacher in Chicago Public Schools, and my presentation is about geography, resources and outcomes, unraveling federal early and primary care disparities in the U.S. And when I speak about outcomes, I'm speaking about outcomes not only related to teachers, but also students. And so much of my research has to do with the resources and demands of the work of those in the early child care labor force. As a bit of a background about myself, beyond what has been mentioned, I am from rural South Carolina. I was down here last weekend for a graduation. There was one high school for the entire county. When I was younger, I moved to Prince George's County, Maryland, which is suburban/urban outside of DC, and spent time in the Midwest, in St. Louis and in Chicago. And in all of those places, I noticed that there were many community needs, but the values were different and the priorities were different and the strategies for building community were different. So this is a bit of an overview of what I will mention today. I will talk about my models, I'll talk about the studies, the methods, and then I have some feedback to garner from the audience, and I look forward to what you put in the chat. So please be active. I also want to say a bit about my background. I studied economics and anthropology when I was in undergrad, and I do feel like that beyond the social emotional development and early childhood development, this really does get to people, what they care about and where they are. So the background for this issue is that there are those who are in the early childhood workforce who are essentially overwhelmed, and many resources are necessary for them to be able to not only get their work done with children on a day-to-day basis, but for them to build communities with parents and family members. And so my main ideas for this presentation are about, where you are and what that means for the resources that you have access to, what the experiences are for early childhood staff members, and what their expectations and beliefs are for the children that they serve or the children that they help to cultivate. And then on a child development level, I think about staff practices, their beliefs in classroom quality and social emotional behavioral outcomes for children. And so I expect that the contribution of this work is to provide an overview of the quality of life for children, the contextual differences of the early care and education experience, not only for children, but also for the families and the teachers. And I think that it's relevant to the current policy context because there have been temporary relief funds provided on a federal level for early care and education. And over the last couple of years, people have struggled, providers have struggled to know how to allocate the resources that they've been given. I know that people have done infrastructure upgrades, they've done training for staff members, they've used it to upgrade classrooms and materials. And the end of those ARPA funds is coming at the end of September, which is funny because that's the end of my dissertation grant funds. So I'm very pleased to have ACF funding this conference and this conference attendance. So I will go through the models very briefly. Theoretically, I use the bioecological model, which says that the interactions that children have in the environment around them shape their social, emotional, and behavioral functioning. And we can think about teachers as a really prevalent part of the quality of those interactions. For the teachers themselves, the job demands resources model of burnout would say that the greater demands teachers have in their work, the greater burnout teachers face, and then their organization outcome, the quality of their work would diminish. And then the opposite would happen. If they had the proper job resources, they would be more motivated and they would have better outcomes in the quality of their work and thus in the outcomes of the children that they work with. The pro-social classroom model would state that when these teachers are equipped to do their work and they have the social emotional competence to do their work, not only will they have a healthy classroom environment, but the school and community contextual factors serve to also promote the student's social, emotional, and academic outcomes. For the first study, I look at a variety of variables. This is a heavily quantitative study, but I will be happy to review any questions that you have. Please enter them in the chat, where I look at the associations between the quality of life for children, the providers, and in the workforce, the job demands and resources for the teachers. So this first study is just descriptive. I got information from the US Department of Agriculture about the quality of life for young children in the US. And so I just want to describe that as a background. There's a little bit of overview for the data. So this is national data on families across geographic contexts. So the main takeaway is that deep poverty for children and poverty for children overall is more prevalent in non-metro areas. And we can also see that there is a pattern of lower educational attainment and lower employment. And the availability of these resources are more prevalent outside of the South and in moderate density settings, such as suburbs and in places where there is lower poverty overall. Now I want to see where teachers are in, for Head Start settings. I do a descriptive work to say, where are the resources? So for urban density, have low, moderate, and high. You can think of low as your rural areas, moderate as suburban, and high as urban. And then the red text indicate that those are the resources that are least prevalent. So, I mean, those are the resources, I'm sorry, not least prevalent. Those are the challenges that teachers face. And then in the green, those are the benefits that teachers have. Those are the things that we want teachers to have, no matter what setting they're in. And so this, looking at urban density, we see, for instance, that in the moderate or suburban places, teachers have the challenge of behavioral problems in children. But in these same settings, there are child care assistance benefits for teachers as well as travel assistance. And for instance, in low urban density settings, there are large class sizes, but teachers receive benefits like retirement, health insurance, and in high urban settings is professional development partners. There are a lot of universities in urban settings, but parents are often arriving to pick up their students late because of traffic probably. So I won't go through all the slides quite as slowly. I'll just pick an example on each, but I just want you to kind of understand what low, moderate, and high mean here. And then in non-Head Start settings, we still see that large class sizes are a challenge, except they're now in moderate areas. And then in the urban settings, again, curriculum training and retirement benefits are most prevalent. So I do a comparison between Head Start and non-Head Start here because I understand that there are different funding objectives and also different funding patterns based on what kind of center people are in. And now I go across poverty settings. So low poverty settings, whereas there's more affluence, moderate poverty settings, and then high poverty settings. And you can see where the benefits are most prevalent, such as retirement benefits in high poverty settings where teachers are, and tuition assistance for teachers to get more education in low poverty settings where there's more affluence, and then moderate stress in children's lives. So here, this is a comparison of non-Head Start settings. I think what's remarkable here is that in the moderate poverty settings, there is no prevalence of any benefit, but also no prevalence of any challenge. And I think moderate poverty and moderate urban density settings throughout this presentation have the unique challenge of not being affluent enough to meet all the needs of parents and teachers, but too affluent to get the same kind of federal support based on low income. Now I go across regions. I'm being mindful of the time, but here's West, Midwest, Northeast. Again, the green indicates where we see the greatest benefits, prevalence of the benefits in that area. And then the red is where those challenges are most prevalent compared to other settings. So I will kind of take my time, but click through these slides and allow you to read them just in the interest of time. Here we see in non-Head Start settings, there are many benefits across the US. And now the South is mentioned as having, again, large class sizes. And so the implication is that rural settings receive less resource investment and have contextual challenges overall. And resources should be considered as a context-specific issue. In study 2, I use data from the National Study of Early Care and Education to provide a geographic overview of how workforce, job resources, and job demands interact with the association between geographic context and teacher beliefs. So the outcome here is teachers' caregiving attitudes and teacher-child interactions, the quality of those interactions with children. Again, I use structural equation modeling here with maximum likelihood estimation. A couple of the challenges of this method I will talk about later, but I'm nervous about time, so I will say up front, the response for teachers was a bit based on their background characteristics. So for instance, Black teachers were less likely to respond to this survey. And I think that what previous presenters have mentioned about the importance of qualitative and community work come in here, because there might be a number of reasons why a teacher might not want to respond to this survey. I did a factor analysis here to develop one common measure with many items across different subgroups of categories. So what I will speak about from here forth is workforce professional development resources, workforce workplace stress or demands, and then workforce collaborative practices and resources. This is how the analysis model went. Don't worry about it too much. Just know that I'll be looking how each of these are associated with each other, whether one is positively associated or opposes or improves the other. But this is kind of how the analytic model looks. Here's some of my suggestions. I would say that in more urban settings, you would have, for instance, more resources. And the results indicate that in low poverty settings, teachers have more positive caregiving attitudes and higher quality teacher-child interactions. And in low urban density settings or rural settings, there were also positive teacher-child interactions compared to moderate settings for poverty and urban density. And then compared to high poverty settings, low poverty settings had actually less positive teacher-child interaction. So in more affluent areas compared to more impoverished areas, teacher-child interactions were less positive, which I thought was an interesting finding. And here I look at all centers, not just Head Start, and I see that compared to the Midwest, schools, for instance, in the South and Midwest had larger class sizes. Okay, 2 minutes, wow. larger class sizes and less benefits like health insurance. And in the South, compared to the Midwest, there was less workplace stress and demands. Here's some positive associations here between location and poverty settings for teacher-child interactions. Similarly, I do this for Head Start settings where we see in the Northeast, there's more health insurance. And in the West, there are smaller class sizes than the Midwest. Okay, is that it? You stop the presentation? Or is it's not clicking? Okay, hold on. I want to be mindful of the time, so I think I'm actually just gonna, oh, did it go back? Okay, this is 33. Okay, actually, real quick, let's just jump because this is the Head Start Family and Child Experiences Survey, and then this is the model. Similarly, I'm looking for associations between these things. So there's measures of classroom quality and the outcome is social, emotional, behavioral. And then our main predictor is the teacher-parent collaboration. So this is a different data set if you're interested in the Head Start Faces survey. And this is how I expect those, better collaboration, better classroom quality, better outcomes. And I would think that community building would help to develop a common belief system between parents and teachers about what students should be doing. I see that my association between teacher-parent collaboration and approaches to learning and social skills is positive, but when teacher-parent collaboration is also associated with less withdrawal in children. So these are overall positive results and maybe what we would expect and supports the purpose of this conference. And then classroom organization leading to more withdrawal with children was a really interesting finding, but maybe too much structure can make kids nervous. So we should be mindful of that. And I just want to hit the conclusion. Yes, there's differences in workplace demands and resources across the US, as well as potentially expectations on what children should be doing. And the directions of future research should expand workforce surveys and maybe try to get to why people are not responding or try different strategies like focus groups to help with that. I'm sorry, I think the clicker might be frozen again, but I just want to thank the conference for allowing me to present and also just thank God, my family and friends, committee members, doctoral advisors, Well Lab, and the Administration for Children and Families, and Department of Health and Human Services for funding this work. Thank you.
Okay, thank you for that, Briana.
Thank you.
And again, folks, please feel free to continue to enter questions for Briana's presentation in the chat, and we will have her address them at the end. So with that, I'd like to introduce our second presenter, Ashley Watts. So Ashley Watts is a practitioner scholar who leads programs and initiatives for Black and Brown children across the city of Houston. As a former Start with Equity Fellow, she understands the significance of equity research in childhood education. As a doctorate in education student, she brings collaborative and whole child concepts devoted to families' well-being. Ashley Watts is dedicated to bridging the gaps in research and practice and providing practical and applied approaches in policy making. And with that, Ashley, I'd like to turn it over to you.
Hello, you all. So today's presentation, this project is Re-Conceptualizing Current Measurements of Accessibility for Black Children and Families. And the presentation truly is reimagining family and community-centric early learning experiences. For today, I'm going to go over this fellowship project in a little bit more in detail, provide you my methodology. I'm going to set the foundation using critical juncture timeline. Then I'm going to share more about the access and how it's conceptualized for Black children and families. Afterwards, I'll provide a case study, and then we will not have time for a discussion, but I will share some resources, and we can move into the Q&A, of course. So with this, really, there's been a long-standing history of systemic practices that have really led us to the point where we are today in childcare. A lot of this is intersectional work. And what we have known, or what this has, become to be known is opportunity gaps that we see within our educational systems. Excuse me. So the role of inequity, the foundational piece for this work was that in 2017, the Office of Policy Research and Evaluation, or OPRE, they released a research series on access to early education titled Conceptualizing and Measuring Access to Early Care and Education. And the report highlighted 5 major domains, which are reasonable effort, affordability, supporting children's development, and meeting parents' needs. And then in 2020, the OPRE released a second article, which then identified a 5th dimension, that being equity. And despite equity being included as a dimension, an equity-centered analysis revealed that accessibility along with these dimensions is not inclusive to Black children and families. That is the overarching takeaway from these articles. So then my research questions are, how has access to early care and education been largely defined and conceptualized? In what ways do these conceptualizations of current measurements include Black children and family? And then what are some policy implications that would foster systemic change to be more inclusive to Black children and families? So for my methodology, again, this project was a product of a fellowship project through the Children's Equity Project. And I did a secondary and existing analysis of policy briefs, a couple of databases. I mentioned them here: Child Opportunity Index and the National Database of Childcare Prices. The major consumption or the major bulk of my literature pieces were policy for policy consumption. Because I wanted to get an idea if OPRE was saying that this is how access is being conceptualized, I wanted to see specifically what literature and other pieces of policies were saying and how that was inclusive or exclusive to Black children and families. So with the critical juncture and understanding how these policies have played and formatted our early education system to what we see today. I'll start with this piece. Systemic practices and broken promises of equality long agonized Black families well after enslavement. Freedom is subjective when considering the amendments that abolished slavery but confined Black Americans. Oppressive laws restricted family to certain workforce roles and stripped access to economic mobility, housing, high quality education, which then resulted in intergenerational trauma. And despite the backbone of childcare being Black women, who were forced into labor for white families, numerous policies then were mandated that left Black women without childcare. And so I wanted to take a brief moment to look at a timeline of these mandates and policies that shaped our, the systemic issues and challenges that we see today. I did prepare a timeline, which I will link in the chat. That is my goal. I understand that this conference is intersectional, and so we have folks from different practices, fields, and areas of research. And so I want to really encourage the opportunity to add to this timeline. Mine was focused on education and early education, but I know that there's policies pertaining to health, social work, et cetera, that really drive this bigger picture. To begin, you'll see that there is a definition of anti-Blackness that is provided by Comrie Williams, and excuse me, Riley Townsend and JD Williamson. And so I put this here that so that you all can go back and reference it, but it really kind of highlights some key pieces within our early education system. This is just a very general snapshot. There are some very intricate policies that really did shape where we are. And I encourage you to interact with the timeline again and reference some of the articles that really provide those key pieces. So again, the domains of accessibility that I'm really going to be delving into: reasonable effort, affordability, supporting children's development, meeting the needs of parents, and equity. So when defining accessibility in early childhood education, which was previously undefined and left out, the guidebook identifies common themes in literature, including availability, utilization of early learning programs, quality, and the cost of early childhood education. Excuse me. And then in 2020, when the second report was released, it aimed to align with the previous guidebook's definition. And again, the equity was added as a fifth dimension, aimed to address disparities among disadvantaged and underserved populations. However, when fully analyzing the report and the policies that pertain to the 5 dimensions of access, it revealed that it revealed that it was not inclusive to Black children and families. One of the primary reasons for that is there wasn't an equity-centric lens, and that a lot of the indicators were aggregated together instead of recognizing and owning that, especially for Black children and families, that there's intersectional pieces to this. We have Black families who are student parents. We have Black families who are also dual language learners that are underrepresented. And so when just looking at race or just looking at household structure or income and et cetera, it leaves out a bigger picture. And so on this slide, I've shared some of the specific pieces of literature that identified and aligned with one of the 5 dimensions. And so, excuse me, in terms of reasonable effort, Black children are least likely to experience quality care. And then again, with reasonable effort, Black children are most likely to live in low opportunity neighborhoods or neighborhoods where a high quality center is not accessible. And we'll move on. For sake of time, I'm going to move on to the case study. But in my fellowship project and the paper, it will delve into different pieces of literature and policies that help shape that, bigger picture based on those 5 dimensions that were identified. So for this case study, I met with a early learning center in Chattanooga, Tennessee, and they originated as a orphanage. The center has some history. They've been around for like 150 years. So they definitely have some history. And based on the needs of the community, they transitioned to a early learning childcare program. They do have different modalities that they offer in their program. This was a qualitative case study. I got to interview the administrative team, and then I got to also meet some parents. And the bulk of the students, of the 400 students, they currently have 400 students. specifically in their early learning extended program. So with this program, the facility operates 24/7 on holidays, on weekends, because in this specific area of Chattanooga, Tennessee, it's heavily dominated by manufacturing plants. And so parents work in shifts. And so they've created a program that also operates in shifts so that as parents are needing care, you know, a child can come in for a certain shift, or stay through the 4 shifts if that's what's needed. And then on a separate note, there's also the foster care that still remains. Circling back to the demographics. So 77% of the students are Black, 90% of the educators are also Black. And so in terms of meeting what has been conceptualized as access, this program has done a stellar job. They have created a program that is data driven. They're constantly evaluating and analyzing what their demographics are, what the needs are of the community, so that their program can change. In addition to the early learning extended program, they have a volunteer early learning program. They have a school age program. They have, those various modalities to meet what they need. For affordability, they utilize a scale that does not recognize the federal poverty guideline, right? Because we know that, and I'm a slide behind, we know that there's working families out there who are still not able to meet their basic needs. And in those basic needs is childcare. Childcare is one of those basic needs. And so they use a scale to make sure that it's affordable for their families. And they make sure that it's not per child, it's based on a family. And then they're high quality, so they have high quality ratings based on the QRS system. They have intervention services for students with disabilities. And they also have dual language services. They utilize a culturally responsive curriculum that allows flexibility for the teachers. And again, the teachers mirror the bulk of the student population. And they operate 24/7 to meet what those families are needing. So I have this excerpt from my paper that I'm going to quickly read before I move on briefly to the policy recommendations. So quality and access to programs alone will not remedy the inequities that Black children and families face. Reaching equitable access will require moving away from a Eurocentric lens of quality and truly meeting the unique experiences of Black children free from harm, bias, and anti-Blackness. Continuing to harm Black children by just providing programs is inadequate and not equitable considering historical and contemporary inequities. In this page, I wanted to encourage that we freedom dream, which is a term by Robin D.G. Kelly in his book, and imagine what this space could look like. I don't think I have time to delve into the different policy recommendations, but if that's a question, that's something that I could answer. And I will move on to this. Okay. All right. Thank you all.
If you want to revisit the policy implications that you've compiled based on your work with the Children's Center.
Absolutely, sure. So one of the first pieces of policy recommendations is that I wanted policymakers to take guidance from a lot of the work we're doing. I want to ensure that parents and caregivers are authentically involved in these processes and they're knowledgeable of these policies and these different systems. I also recommend that we promote collaborative thinking and actions across various systems. similar to this conference where we have practitioners and researchers and everyone in between, and a lot of intersectional work taking place, and any opportunity to amplify Black voices to narrate and storytell. The second one is to prioritize access to inclusive care at state levels and increase accessibility in general, so that slot demand that is affordable, and invest in equity and equality for Black children, particularly in funding for federal programs such as Head Start and CCDBG, and allocate funding to enhance neighborhood and geographic accessibility in those neighborhoods where I specifically discussed where there's low opportunity. Establish incentives and accountability measures to ensure states provide fair access to high quality providers. This includes reducing barriers, eliminating red tape for enrollment and eligibility to families. And then enhance efforts for research and data collection focused on Black children and families, such as we see here with this organization. And lastly, emphasize culturally responsive practices to center Black students and families, including Black immigrants. Knowledge and supportive increasing number of Afro-Caribbean agreements and early learning and care programs, especially when we're thinking about immigration policies, making sure that they're inclusive to the large number of Black immigrants we have here in the States. And that is all I have.
I was curious, you mentioned that this organization originally started as an orphanage. They morphed into what is now this robust, high quality, accessible childcare center. What were some of the lessons learned as other childcare centers try to think about how to retool and integrate some of this? Because I imagine that was sort of part of their growth pathway to kind of retrofit some things and create new things, because I think all of the different implications that you mentioned are important, but how can organizations think about incorporating some of that in their work, given that they've already started?
That is a great question. I think that, well, one, I don't want to speak for them, but I think as organizations are planning how to transition and you know, kind of meet the needs of families, because you know, what we're gathering and what we're seeing is that there are a lot of needs that aren't being met. I think one is being data driven, and then having those opportunities for parents to serve as the experts. Similar in the Head Start model, where there's councils and meetings routinely where parents provide that insight so that they are aware, and using that material to evolve. I think it's a program evaluation piece, and I hope that I framed it. I hope that was what you were asking.
Yeah, that's right. Yeah, thinking about starting places. And I think you gave some great recommendations for how other organizations can start to think about that. I wanted to ask about any other thoughts about the updates to the OPRE manual. You know, I know equity was added, but feel free to offer any other thoughts.
There has been some amazing work that has come out recently, and not just in OPRE, but in OPRE, but just in addition, there's a lot of conversations on non-traditional childcare that's taking place in the research world. Excuse me, you all. Yes, so there's great work taking place. I really enjoyed the piece that OPRE released recently on non-traditional care. As we've seen in our research and you know, other later reports, Black women and men experience job insecurity and that economic instability piece the most. And so thinking of what that need is so that parents are able to work when they do get work is really big. And so I'm really excited. There's been some great work being done and a lot of articles that have touched these non-traditional spaces.
Thank you. In these 2 minutes for concluding thoughts, I would like to say that there are differences in the workplace resources and demands for early child care providers and staff across geographic contexts. And so for federal programs such as Head Start, which are, funded in the billions, the best way to allocate resources is to actually consider the needs of individual staff members. And so I think that this could, at a program level, be very detailed surveys for staff members, for those just reporting to their directors about what they need. And so that on a person-to-person level, there could be team building for teacher collaboration as well as teacher-parent collaboration. And the results in my study showed that teacher-parent collaboration was advantageous for social, emotional, and behavioral outcomes for children. I also want to say that survey non-response in large national studies, such as the National Study of Early Care and Education, is a problem and was significantly correlated with background characteristics for teachers, such as their education level, income, years of experience, and race regarding Black, African American, and Hispanic teachers. And so the challenge, even in reporting these results, would come in with something like bootstrapping methods that could adjust for the missingness in the data set. But that is not going to be the most accurate reflection. The most accurate reflection would be for people to be able to respond, if not in a large national survey, then in a focus group or in some kind of team building way where they can get their needs met, particularly when there are time due dates for funds or for funds to be spent. You want to spend them as well. And I feel like that something that this work that I'm presenting here does not get to is like the real true social cultural needs of an education space, but taking a step back when thinking about funding and broad federal programs that are largely advantageous for low-income families. These are some important considerations.